It is kind of way early. It's like not even 2:30 in the morning. But when you're bored, you're bored. Three things to know about 45's budget plan for Medicare and Medicaid. 45 said he wouldn't touch Medicare before pitching a budget plan that would do exactly that, along with steep cuts to Medicaid. Democrats are calling it savage and heartless, which is what the 45 administration is. They're heartless. They don't give a shit about anybody but themselves. While the administration officials are insisting they are only slow and explosive growth in future years and that current Medicare benefits would remain untouched. Here are three things to know about the election year fight on healthcare spending. 45 proposed spending $1.6 trillion less in future healthcare spending, and it also included a $451 billion tax cut for Medicare. On Twitter 2 days before releasing his budget, the squatter said we will not be touching your Social Security or Medicare. It was a promise he also made in his Clan of the Union address. Whether he broke that promise depends upon how you look at it, and yes, he broke that promise. There's no doubt the squatter's budget plan would whack away at federal spending on healthcare over the next 10 years with an estimated $1.6 trillion reduction, including a $451 billion reduction on Medicaid and $920 billion reduction for Medicaid. $451 billion reduction for Medicare and a $920 billion reduction for Medicaid. The 45 administration is loath to call it a cut, though, because it applies to future spending plans only and budgets wouldn't decline compared to current spending. When asked for details, the Health and Human Services Department declined to talk in terms of dollar figures for Medicare and Medicaid, offering only what the plan shows, which is the average growth rate on Medicare by a small percentage over a 10-year period. Overall, HHS stated funding levels will be no lower each year than they are today. The dollar figures were provided by a senior administration official who spoke to ABC News on condition of anonymity, as the estimates were also confirmed by independent budget analytics and analysts, stuff like that. The Democrats were unmoved. Don't get in front of an audience and say I'm here to protect Medicare and Social Security and put a budget like this forward, Pelosi told reporters on Tuesday. The plan won't impact Medicare benefits, well, at least all of it. 45's health policy experts also argued that the plan for slowing growth in Medicare won't impact benefits, but rather slow providers like hospitals are paid. Tricia Newman, a policy expert at the nonpartisan Kaiser Family Foundation, said the administration is right that the plan cuts the growth in Medicare spending without actually cutting benefits for current enrollees. But she also notes that it includes a proposal that would make it harder for some seniors to qualify for long-term care services for an estimated $34 billion in Medicaid savings. Separately, the plan also proposes $135 billion in savings from drug pricing reforms with few details, she notes. But those policies aside, there's another reason that 45's budget plan is unlikely to have an impact on the Medicare recipients. It almost has no chance of becoming reality. Democrats control the House and an election is on the horizon. What the budget provides is a blueprint for what 45 would try to accomplish if given the opportunity. It's essentially a starting off point for budget discussions in the campaign debate, but it's unlikely that lawmakers on either side of the aisle would have the appetite, especially in an election year, to chip away at healthcare spending. If re-elected, which we don't want 45 to be re-elected because we can't handle 4 more years of him fucking up. It has Medicaid cuts in his sights. Medicaid is the government-run health care insurance for people with low incomes and disabilities and covers 1 in 5 Americans, and according to the Kaiser Family Foundation, it finances nearly half of all births in the U.S. Under 45's 10-year plan, $920 billion in future spending would be cut, according to the senior administration officials and analysts. Like Medicare figures, HHS declined to confirm that figure, saying that only the plan shows average annual growth from a 5.4% to a 3.1% to ensure a more sustainable program for the truly needy and give state flexibility to perform and innovate. The plan factors in savings by imposing work requirements as a condition of accepting Medicaid coverage for people who aren't exempt. Democrats clearly plan to use the proposal as a talking point ahead of the election, with Senate Minority Leader Chuck Schumer, who's a Democrat from New York, on Tuesday calling it a blueprint for destroying America. Now the American people can clearly see what a fraud 45 is, and he's not fighting for them.